Hey, I just thought I would check in. Okay, so I've had two FEC chemo treatments. I'm gonna have my third in a couple of days. Um, the side effects kind of gradually escalated per treatment. Like, so with the first one, I had a really bad pain in my mouth. A wisdom tooth was trying to come in. It's been doing that off and on for a couple years now. So it got really inflamed and swollen, and it hurt all up here and in my jaw, and it actually moved all the way around. So I got put on antibiotics for that. Had a little bit of nausea, a lot of headaches from side effects from the medicine that they prescribed me for the nausea. So they'll give you, I guess it varies, but I was given before my first treatment Zofran for nausea, Compazine for nausea, Ativan for nausea and anxiety, ENT mouthwash for the mouth sores, and I think that's it. And then you get pre-meds as well. I found that the Zofran gave me intense migraines, so that wasn't good. And then, so I got through my first treatment, took my second, and then I could tell, coming out of treatment that day, that it was different this time. Just felt different. So about 3 days in, I went home that day and I slept, and actually went to work the next day, made it through work. The day after that is when everything really hit me. I got an extreme pain starting in the back of my head, and it worked its way down and into my neck, and then across my shoulders, and then down into my lower back. And it was like a huge, deep bruise all the way from top to bottom. Hurt to touch, hurt to sleep, it hurt to anything. The nausea was a little increased, and I had horrible trouble sleeping. And so I called my doctor and I let her know what was going on. Actually, I can't ever get to my doctor, my oncologist. She has this nurse that blocks for her, I guess. And so when you contact her, all you get is this nurse I'll tell you about that in a minute. So I contacted the nurse and I, told her what was going on. Actually, I think I told I told the doctor at my second appointment for my chemo that I was having trouble sleeping. So she added the lowest dose of Ambien to help with my sleeping. I was told at that appointment that if it didn't work, just to let them know, and they would increase it. Excuse me. So, I tried to do that anyway. So I had the pain, and I still had trouble sleeping after my second dose, the nausea. And then, so the Zofran, because of the headaches, had not been taking that. I was just taking the Compazine, Ativan. But the nausea was getting worse. And the pain was really bad. Really bad. I even had tingling in my hands and feet. Extreme nausea, stuff like that. Extreme fatigue. I slept a lot. So anyways, so I called the doctor, got the nurse, obviously. I explained to her that I was having, the pain, my nausea was worse, I had dry mouth, and the pain kind of spread from my port, which is right there, and it kind of seeped, I guess is the best word. It's like a seeping pain. Also had constipation. It was horrible. The first 4 or 5 days, didn't go at all. And it was just so painful. It got so painful. And also my heart races when I lay down. So I told her all of this, and I also told her that I could not sleep. And I asked if we could, increase my dose or play with my medicine a little bit. Basically, I was told that no. And there was no compassion. It was almost like I was bothering her. Every time I contact this doctor, her nurse acts like, honestly, she's rude. No compassion at all. So I was told that she's not going to do anything, and that if I chose to take increased doses of the medicines that are working for me, then I was just going to run out. So I'd be pretty much SOL, shit out of luck, which really concerns me. The fact that I can't get relief for my symptoms. Chemo's already hard enough. And it's not just chemo. It's like the stress of, like, am I going to be able to work through this? I lost my hair. I'm sick. Constant doctor's appointments. It's stressful and it's uncomfortable. And when you have cancer, you are uncomfortable enough. And I feel like, I have chemo brain, so I can't think of words sometimes. I feel shorted. I feel like I should be provided with better relief. Pretty discouraged. Like I said, I have my third and final FEC chemo in a couple days. I'm really nervous about this because, like I said before, it kind of the symptoms, in my opinion, have increased per dosage or round. And then after this one, I'll do 12 weekly Taxols for, 12 weeks. And then I guess I'll do the surgery. Also met with my plastic surgeon yesterday, a really nice guy. And he has recommended delayed reconstruction. So I guess I'm going to go home from that excuse me, mastectomy boobless. And then, so I'll heal from that, and then I'll go have expanders put in, expand those until I get my desired size, and then I'll have the implants. So that's 3 surgeries right there already, plus this chemo. So it sucks. I have continued to work full-time on the weeks that I haven't taken chemo. I can't really work the weeks 3 or 4 days after chemo. So yeah, that's how it's going so far. And it sucks. It is doable in my opinion, but it's overwhelming as well because it's just so much. So many appointments and so many months that I'm looking at, and it seems sometimes like there's really no end in sight. I know there is one, and I'll look back on this in a year or two, and I'll be amazed that I got through this. Wow, I have some bags. Yeah, so it also gives you bags under your eyes, and it breaks your skin. Look, I have these breakouts kind of everywhere, and that black spot didn't used to ever be there. I don't know what that is. So it's gotten my skin kind of blotchy, and that's dry skin there. So yeah, chemo sucks.